In America, everyone counts, and the 2020 census is how that great promise is kept. Respond today online, by phone, or by mail, and help inform hundreds of billions in funding for education, health programs, and more. Shape your future. Start at 2020census.gov. We have crossed the 200,000 death threshold in this country. More than 7 million people have been infected as a result. The Trump administration pretty much wants to say, y'all, this is all good. These things are just moving along. The majority of our deaths have occurred within the 3 months. On average, over 1,000 people died every single day. Now, nearly 4 months later, the country has doubled that figure. As of Sunday evening, again, the official death toll has surpassed 200,000, the highest death toll in the world. Some experts think the numbers could double before the end of the year, bringing the death toll up to 600,000. Joining us right now is virologist Dr. Cindy Duke. Dr. Duke, I'm sitting here looking at, again, a lot of the people, these critics out here, people who say we're hyping this thing up, who say, oh, this thing is leveling off, that it's dissipating and disappearing. As a virologist, are you seeing that?
Unfortunately, no, we're not seeing that. We're seeing in some pockets of the United States where people have taken the precautions seriously, where people are wearing masks, where people are following those guidelines, we are seeing things plateau. But we're still seeing really high numbers in many other places where people are being very complacent with their strategies for protection, wearing masks when they feel like it or not at all. People are taking unnecessary and undue risks at this point in many parts of the country. And unfortunately, what we're seeing is, yes, the United States now accounts for greater than almost 25% of the deaths from COVID-19 globally. One country of almost 200 countries in the world, this one country accounts for 1/4 of the deaths.
So the people who say, hey, look, it's no big deal. We also are about to go into winter. What must we be preparing for with that? Because now you're talking about mixing COVID and flu, mixing COVID and pneumonia. Please talk about that.
We are entering what is traditionally our respiratory virus season. And so that means now things are getting even murkier in the sense of when someone starts having symptoms, what is it that they're having symptoms of? Is it COVID? Is it influenza? If it's a child, is it, RSV? What are we coping with here? And so, the first thing to tell everyone is really, we should be wearing a mask. And this isn't something that's up for debate anymore. It's very well proven, very well established that masks save lives. And I know some people are going to say, well, I know the one person who wore a mask and still got COVID. Sure, one person. But you know what? If we don't all wear a mask, hundreds, thousands of us will become positive and spread it to even more people. Now, that said, I would also like to encourage everyone to get their flu shot. This year, more than ever, we need to get our flu shots. The big issue about, flu season coming and why everyone's so worried, particularly healthcare providers like myself, is our hospitals are still overwhelmed with COVID-19 and all the other things that people go to the hospital for. With flu season comes a surge and a need for the same resources that COVID-19 patients also have to use at the hospitals. And so the fewer people who have the flu who end up sick and need to go to the hospital, the better. And so it's really important that everyone out there take these steps and take it seriously, right? And in the communities of color across the nation, it's especially important that we have our children vaccinated, that our teenagers are vaccinated, our elderly are vaccinated. We need flu vaccine drives just as much as we're doing drives to get people tested, to encourage people to wear masks when it comes to COVID-19. We need them to get their flu shots as well.
All right, then. Well, Dr. Cindy Duke, look, we certainly hope people take that advice. Take this thing seriously. It is still real. We want them to understand that. So we certainly appreciate it. Thanks a lot.
Thank you so much.
All right, then. All right, folks, back to our Roland Martin Unfiltered video in just one moment. As our community comes together to support the fight against racial injustice, I want to take a second to talk about one thing we can do to ensure our voices are heard. Not tomorrow, but now. Have your voices heard in terms of what kind of future we want by taking the 2020 census today at 2020census.gov? Now, folks, let me help you out. The census is a count of everyone living in the country. It happens once every 10 years. It is mandated by the U.S. Constitution. The thing that's important is that the census informs funding, billions of dollars, how they are spent in our communities every single year. I grew up in Clinton Park in Houston, Texas, and we wanted new parks and roads and a senior citizen center. Well, the census helps inform all of that and where funding goes. It also determines how many seats your state will get in the U.S. House of Representatives. Young black men and young children of color are historically undercounted, which means a potential loss of funding for services that helps our community. Folks, we have the power to change that. We have the power to help determine where hundreds of billions in federal funding go each year for the next 10 years. Funding that can impact our community, our neighborhoods, and our families and friends. Folks, responses are 100% confidential and can't be shared with your landlord, law enforcement, or any government agency. So please, take the 2020 census today. Shape your future. Start at 2020census.gov.